Mycobacterium tuberculosis. The bacteria that causes tuberculosis is deadly bacteria that kills over 1 million every year. Tuberculosis can be spread through the air when a person with active tuberculosis coughs, sneezes, speaks or sings. These germs can stay in the air for several hours depending on the environment. Tuberculosis cannot be spread through things like sharing food, shaking someone's hand or contact of the same objects that have been used by someone with active tuberculosis. So don't worry if you have active tuberculosis. You can still go to that important work meeting and participate normally as long as you don't breathe, speak, cough or sneeze. Tuberculosis can be caught and not affect a person whatsoever. This is known as latent tuberculosis. Latent tuberculosis consists of bacteria that lives in granulomas and can turn active at any given time. In common cases, this can be turned active after 2 years of initial infection. Tuberculosis is resolved by the treatment with antibiotics that is used to kill all the germs and cure the existence of mycobacterium within the infected body. Although tuberculosis may show different symptoms in different individuals, a list of common side effects include the following: breathing difficulty, coughing up blood, excessive sweating particularly at night, signs of fever, and experiencing unexplained weight loss. There are 2 kinds of tests to diagnose tuberculosis, the most common being a skin test with the abbreviated name TST, and a blood test called an IGRA. During these tests, a doctor will examine your lungs and lymph nodes. A skin test is performed by injecting a small amount of tuberculin into your arm, and it requires a later checkup to see if it has had any effect on the skin. A blood test measures how your immune system reacts to the germ causing tuberculosis, and it can help rule out if you have active or latent tuberculosis. These tests don't always give a perfect answer or explanation, so sometimes doctors may call for a chest X-ray or a CT scan to be done. This can help find physical signs of tuberculosis. I'll be taking over for the second half of the video, and I think now is a good time to take a short break. Were you paying attention? Because it's quiz time. Question number 1. What is not a way tuberculosis can spread? Is it answer number 1, coughing? Is it answer number 2, shaking someone's hand? Or is it answer number 3, sneezing? I'll give you 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. If you said answer number 2, shaking someone's hand, you are right. Congratulations for paying attention. Now let's get to the second question. What is not a known tuberculosis test? Is it answer number 1, the TST, answer number 2, the IGRA, or answer number 3, the TBRT? I'll give you 10 seconds to lock in your answers. 10, 9, 8, 7, 6. Actually, that's enough time. If you said answer number 2, congratulations, you're wrong. The real answer in number 3, the TBRT. Now that you know the basics on tuberculosis, let's talk about treatment and prevention, and a little history lesson on it. The drugs used to treat tuberculosis are isoniazid, rifampin, ethambutol, pyrazinamide, and rifapentine. It is important to take all your medications for it to be killed off completely. Side effects of the meds may include skin rashes, nausea and upset stomach, itchy skin, yellow skin or eyes, and dark urine. Certain side effects might be a sign of liver damage. There are vaccines to help prevent tuberculosis, available in some countries but not the US. A known vaccine, Bacillus calmette-guerin or BCG, is used on children in countries with high rates of tuberculosis. The vaccine helps prevent meningitis and a serious form of TB called miliary tuberculosis. Unfortunately, use of this vaccine makes skin tests less accurate. Tuberculosis is thought to be many million years old, but we only have evidence leading back to about 9,000 years ago. Evidence of tuberculosis has been found in mummified Egyptians, as well as found being mentioned in literature written by Greek physician Hippocrates. Tuberculosis was a big problem in the Middle Ages. It was known as the White Plague, sweeping through villages and towns, sickening all in its path. I hope you're well educated on tuberculosis now. Thanks for listening.